Can you see? Okay. At this time of the conference, we are already bored with the long presentations, but never mind, mine will be a very short one. I will try to cut it short and summarize all the slides at about 10 minutes. This is the, what's happening? Okay. History of cupping therapy, we already know these slides. And I want to mention one thing, Unani medicine is the medicine system, the traditional medicine system of our geography. And I believe it should be named as Anatolian medicine because as it was assumed, we assumed that the Unani medicine begins with Hippocrates, and Hippocrates and others all lived Anatolian geography. So we see the first footprints of cupping therapy in our geography, beginning with the ancient Greek medicine. So these are from Hippocrates' time, and this set is a Greco-Roman cupping set. And famous Greek physician Hippocrates and famous Roman physician Galen both lived in Anatolia. And no need to remember the others, the Muslim scholars, the Muslim physicians, Avicenna, Farabi, and Ottoman and Selçuklu physicians. And in Muslim world, especially in Anatolian region, the cupping therapy application has been inspired by the narrations of Muhammad sallallahu alaihi wasallam. We have already heard these narrations from him in the sessions before mine. And numerous Muslim physicians use cupping in their treatments. I have shared Yadigar, 15th century Ottoman medicine book, and also in the famous Avicenna's book, Kanun el-Fittib, and in many others, we see the guidelines and other treatment methods of hijama. Cupping in India and Africa, why I did share this picture, because in India and Africa, they use animal horns. They place the white side of the horn on the skin and suck from the thin side, narrow side. So they use cups, horns as cups. But in Turkey as well, it has been used traditionally. I mean, those horns, especially sheep horns. When I first met hijama in my medical professional experience, I was a young doctor when I just graduated from medical faculty, and I have been sent by the government to do my mandatory service in Gümüşhane. It was at about 1,000 kilometers away from Istanbul, in the Black Sea region of Turkey. I met a man who was working in the medical government issue. He was talking about an old man in his village who was using horns, placing horns on the head of the people who were paralyzed, and after taking blood from their heads with horns, they were immediately standing up and beginning to walk. Actually, in that time, I was already very curious about complementary medical systems, especially phytotherapy, but this was even more for me. I didn't believe in him. I told him, "You are joking. How can one man, although he was paralyzed, can go out and begin to walk and run?" But later I heard from the same family, because in that time in Turkey, hijama was not known, especially among the health professionals, but underground, some people, some families were practicing it. And I met another man from that village, from that family. He was an intelligent man. He was actually a high school teacher, but he also studied Arabic. He knew Arabic, so he has improved himself in hijama. He told me that this is hijama, this is the sunnah of Rasulullah sallallahu alaihi wasallam, and he was practicing hijama as he has seen from his ancestors, but he improved himself by reading some Arabic texts, and he told me about hijama, and I was interested in hijama at that time, but it was before year 2000. Later on, I met some other people who were experienced in hijama, and I began practicing hijama after 2006. This was my beginning, my own history actually. But in Turkey, this has been a great beginning for hijama. In year 2014, regulations was declared by Ministry of Health in Turkey. Actually, this was parallel to World Health Organization strategy. As you know, World Health Organization also declared a strategy in that year, 2014, and with parallel to that strategy, Ministry of Health in Turkey recognized complementary medicine and 15 applications, complementary applications. I don't want to review all the regulation, but I want to emphasize this one. In that regulations, Ministry of Health said that applications can be made in the practice centers authorized by the ministry, by a doctor, a medical doctor holding a practice certificate in the relevant field, or by a dentist only in the field of dentistry. This means only medical doctors can practice complementary medical applications, including hijama, and he or she, the medical doctor, should undergo a course and have a certificate which was approved by Ministry of Health. And as for the other health professionals who have basic training in the field of practice, can assist certified physicians in practice in centers and units, which I mean nurses, physiotherapists, etc. And those 15 have been recognized by Ministry of Health in Turkey, starting from acupuncture, apotherapy, phytotherapy, hypnotherapy, iridotherapy, and etc. And cupping therapy is one of them. And I want to show you some pictures from our training center in Ümraniye. Ümraniye is a training hospital which was located in the Asian part of Istanbul, and we are a branch of University of Health Science in Istanbul. In this center, we do not only practice complementary therapies, including hijama, we also give training to the doctors who want to practice those complementary applications, including hijama. This is our team. Dr. Emin, Professor Muhammad Yusuf knows him. And those are the students from our university. They are not medical faculty students. They are the students of High School of Medical Sciences. And one of them is our assistant in family medicine. And what do we at the moment apply in our center? Cupping therapy, hijama, is the most referred one. Acupuncture, phytotherapy, iridotherapy, and ozone therapy. Iridotherapy is a leech therapy, and sometimes we begin treating patient with hijama, and we can continue by leech therapy because they are very close to each other. And moreover, we are also authorized by Ministry of Health to run courses on the following applications: cupping therapy, hijama, iridotherapy, phytotherapy, acupuncture, and hypnotherapy. Professor Mohammed Yusuf has attended one of our courses and he has got his certificate. Thank you. And I want to show some pictures from our center. This is the entrance of our center. There are separate rooms where we apply different complementary applications. This is our room for acupuncture. This lady, Dr. Aisha, is performing acupuncture here and now showing and telling acupuncture to the students. And this is our room for ozone therapy. You can see there's a patient having ozone therapy, a back ozone therapy, and the students are listening to us. And this is our room for hijama therapy, the patient, and I am telling to the students on the patient how to practice and apply hijama. As you see, I am applying the first suction. Yes, this is a patient complaining from fibromyalgia and myofascial pains, especially neck pain and shoulder pain. Yes, I think this was a video. Cannot play the video.
We didn't transmit.
Actually, it's loading.
There is no source.
Okay, I think we cannot play it. Anyway, this was just the basic application of the hijama. In our center, we also run some clinical trials. At the moment, two postgraduate students who are doing MSD in complementary therapies are running two clinical trials in our clinic. One is the efficacy of hijama on fibromyalgia, and the other is the compression of acupuncture and hijama on migraine headache patients. So ours is one of the three training centers in Istanbul. There are many practice centers, but training and research centers are limited in Istanbul. Two of them are the branches of our University of Sales, and the third one is attached to a private university known as Medipol University. Ours, one of those three. If you have, inshallah, one day come to Istanbul, maybe have a opportunity to visit our center. Okay. I think this is the end of my slide series.
Thank you very much,
Okay.
Professor Süleyman.